The topic is acupuncture for pain control after Caesarian section, a randomized placebo-controlled investigation which we recently completed, and but didn't publish the results in the paper, so it's pretty fresh now for you. So I don't have a real conflict of interest, except that one small German company supplied us with the so-called placebo needles. They actually the adhesive tapes, so I can show you afterwards. So we have a little bit of time after. Well, thank you for coming in this early hours. Probably some of you remember my first presentation here. It was 2011. I gave a talk about so-called quality management system for improvement of postoperative pain in our hospital. So we introduced this quality management system, and it still works even better than quality management systems for German diesel autos, for example. Well, and so one instrument of this quality management system is the annual annual audits. So we check the pain levels in all the wards and departments twice a year, and we reached pain reduction in all departments except obstetrics, except patients, women after Caesarian section. And you see here this comparison that patients after Caesarian section, they have mean 6 on 10 numeric rating scale in comparison with other surgeries. And these other surgeries were laparotomies. So, but laparotomies, they receive somehow more analgesia. Interesting that the women, the women after Caesarian section, they're more satisfied despite these high levels of pain. So obstetricians can sleep quietly. They won't be sued because of high levels of pain. But this abnormal situation, and we were very hesitating, even ashamed of ourselves. We thought that it's the problem only of our hospital, but we're somehow relieved when these 2 studies in anesthesiology and the European Journal of Pain came out. There was a big longitudinal study, prospective longitudinal study in 100 German hospitals, at university hospitals, over 50,000 patients, where the various kind of surgeries were studied in regard of the level of postoperative pain, and also patients after Caesarian section. And the colleagues, this was the this is the famous group under the guidance of Winfried Meissner from the University of Vienna. They found out that more than 60% of patients undergoing Caesarian section CS, they didn't receive opioids. That pain on movement was also as high as in our hospital, so it's not only our problem, this seems to be the general problem, and that pain compromised all possible daily activities. So it can be explained. It can be explained with the arguments, well, there's nothing is really registered for this indication except paracetamol. All other pharmacological agents are under responsibility of the obstetricians. Well, women, they want to take care of their child, so they want to be mobile, and when they read the breastfeed also, and when they read the potential side effects sheet, so they say, well, better tolerate some pain, and so you can explain this academically or somehow. But it's as a patient, it's rather it's very unsatisfactory. I could feel it on myself, so not on myself, but my wife was once in a delivery room. She received Caesarian section, and afterwards so got this schema. this is, you see, it's almost nothing. So, and at that time I was already a staff anesthesiologist and professor and so on, and I came to the delivery room and said, so please give her a PCA with pyritramine. This is a morphine, like a morphine, which is used as a drug, like a morphine, which is used in Europe to treat pain. And the nurses said, well, we have our orders, and they went to call the chief of obstetrics, and at that time, so I was waiting. It was weekend, so it's usually in life, and I thought, what can I do to relieve her pain? So I have several needles, so I put the needles, and she reported some pain relief. And near there was another woman, the wife of my colleague, also anesthesiologist, the same situation after CS, so I put needles in her, and also she reported also pain relief. So it was interesting observation, and so we had a luck that we had several children afterwards, and they all were scheduled elective Caesarian sections. So before the birth of our second child, I scanned the literature, and you see, except that the evidence is solid for acupuncture as a treatment of acute postoperative pain. I picked out the most effective methodologies of acupuncture for treatment of postoperative pain, to apply it in this case after Caesarean section, because you don't have alternative there. So then you see this. Well, I use like segmental acupuncture, this known point large intestine 4, and auricular acupuncture for our second and third child. And so I did it before. I did it also with indwelling fixed needles. So this the small pieces of metal I show you, this everything is CE certificated, so it's used here in North America and Europe. Well, and as a result, my wife stood up when the motor block of spinal anesthesia vanished, and asked to remove a Foley catheter, and received 1 or 2 doses of paracetamol, and was pretty satisfied with this. And also I did a couple of my doctoral students who asked me to do this because they knew that I did some, and so it was everything was fine. And then the nurses of prenatal ward have seen this and said, oh, that's great. So the patients were happy after acupuncture, and then once they see at the moment when I put the needles, CTG, so cardiotocogram, yeah, it's and they've seen that under the needle stimulation the uterus relaxes, so they were so convinced. They asked, can we do this, can we learn this? And say, okay, it's just like a case report, let us do proper research. And the first step, we did a pilot study where we just prospectively acupunctured 20 women scheduled for CS, and you see here, and compare them with historical group of standard therapy, and you see that after acupuncture they reported pain of 4, so this is acceptable, and they were also happy with this. So it was the first step, and we tested methodology in this pilot study and calculated a number of patients needed for randomized control studies. So the aim of our randomized control study was to compare Verum acupuncture with placebo acupuncture in regard of the effect on the postoperative pain, analgesics requirement, and patient satisfaction. The study was randomized. We did it concealed randomization from all the staff, also from acupuncture, so they didn't know whom they were going to acupuncture. So the 2 study groups, Verum acupuncture, 60 patients, and placebo acupuncture, 60 patients. It was blinded, so patients, staff, the evaluators of the outcome. We did it in our hospital because, it was an unfunded study, and I have a bad experience with multi-center studies with the Charité from Berlin and others. So you're waiting for the next center, and it never comes. So we said we'll do it by ourselves. We got it through the Ethics Commission and registered at Clinical Trials now. So there were the inclusion criteria, just ASA 1 to 3 women in certain age scheduled for elective CS procedure, and some exclusion criteria to get the possibility to measure the outcome. What we did the same procedure as acupuncture as I've shown you. So this is splint pancreas 6-point, this is stomach 36. This segmental acupuncture from one famous paper from Japan published in Anesthesiology, and from that paper we also got this trick with indwelling needles. You see, this is 5mm needles, intradermal. We put them and then put the adhesive tapes. There are these adhesive tapes. And we did also some auricular acupuncture. We have some expertise. We already published one paper in Canadian Medical Association Journal for years. So you see that's just the stimulation of cranial nerves, vagal and trigeminal areas. Well, and one of the tricks was the use of intradermal needles, 5mm, and then we put on them adhesive tapes these placebo needles. These placebo needles, they don't have needle. We can look afterwards. I have a couple also. So there were also a certain procedure of us. We were 2 anesthesiologists who went to a patient, and one of anesthesiologists informed about the acupuncture, about the effects and side effects, so distracted somehow, and one of the anesthesiologists performed the acupuncture. It was mainly me when I was there, and the placebo procedure was just putting these adhesive tapes on the nearly in the areas where the acupuncture points are. And in order to enhance the placebo effect, because of course each patient feels if you put the needle or not. So when my colleague distracted the patient, I used this pencil. This pencil acupuncture tools. Know this stuff is used usually to look for acupuncture points on the areas of low resistance, and then if you find the areas of low resistance, this light making diet is like, well, and just I make pressure with this pencil like the pinch of the needle, and so it was the acupuncture was mimicked. So it was our placebo procedure. Well, we measured pain intensity on moment and at rest using our standard protocol, which we use since 2008 for pain audits. We measured also analgesics requirement after CS surgery, light quality items, recovery profile, and the quality of blinding. Well, here you see the flow of our investigation. So Mecklenburg-Vorpommern, this federal land, has only 2 million inhabitants, and so our care areas 1 million maybe. So we don't have too many. The study ran from September 2015 to May 2017. You see here then roughly the quarter of patients, they didn't want to have acupuncture. We didn't analyze the psychological profile of them yet, but roughly I can say this is so the repeated Caesarian sections. And so here, these patients we couldn't randomize because the CS surgery was done as an urgency in the night or somewhat before, and we randomized 120 patients into 2 groups, and we have some patients with incomplete data, but we analyzed all of them, like intention to treat analysis. And here you see demographic and intraoperative data, and you see here demographic data that there's evidence that our randomization worked perfectly good here. And well, a duration of surgery was also comparable. I don't know how the surgeons here, well, how long do they need? Longer?
Yes.
Because, well, 36, this, including our, because in Germany, I've told you, there's some residents, they have to exercise, and sometimes they're very, very long. So usually they're faster. Well, interesting. And you see here that the acupuncture group had several patients more than a placebo group in terms of blood pressure decrease. It's a 20% drop, and they had definitely more bradycardias, because it's also plausible, because we did ear acupuncture, this vagally innervated areas, and so probably because of this we need more atropine injections. So this is here, it's not statistically significant, but it's clearly clinically relevant. You see, so if you inflate the groups, so you also reach statistically significant result. Well, that was our main outcome measure, pain. So the patients who received real Virum acupuncture, they had less pain. So actually I expected they will have 4 or less. It's slightly more than 4. It's 4.3. I tell you afterwards why it comes. But the difference was pretty satisfactory. The difference was 1.7 on the this 10 point or 11 point scale, and this is clinically, you feel clinically this pain and this pain difference. The analgesic requirement was also comparable in both groups. So this is pyritramide subcutaneous injection. So actually this is the Stone Age, but we couldn't convince our obstetricians to change this schema. This is, they say legally they are okay, so they are satisfied with this, and you've seen the women also satisfied, so, and they do it. Well, the most interesting thing that we didn't expect that it works so obviously, but what the nurses also predicted, they told us that the patients somehow more happy and they are more faster on their feet. So you see that in acupuncture group more patients were sitting and standing up already on the surgery day. So 13 versus 0, and so fully catheter removed, and the ambulation. So in Germany they say it, so they walk to the toilet. It was also faster or enhanced in the group who received real acupuncture, and this is both statistically significant result, and it's also clinically relevant. Well, then we asked patients about their opinion. What do they think? What kind of study intervention did they receive, acupuncture or placebo? And we also asked them if they want to have the acupuncture again in case of the next Caesarian section. I have to say that we asked this in the moment when we already removed the needles, and so the patients, they have seen if there were the needles under it or not. So this is now our observation that we have. If we check the results, it's actually the quality of the blinding. We have to ask the patients immediately after putting the needles in, and we put the needles before CS surgery. Well, but you see here there were no differences here, and the majority of women, they didn't know where they are. It was acupuncture or or placebo, because our blinding methodology was effective. And the majority of women, they wanted to prefer to get acupuncture again. And also the most interesting result, also for probably out of this study for acupuncture, is that it seems to that it does matter that who makes acupuncture, if experience of acupuncture. So the problem was, I've told you, this difference between placebo and real acupuncture in treatment of pain was not big as we expected, because in this time period I started to work here at McMaster. So I went from time to time to Germany also, and then did acupuncture for the study. But in some cases, my colleague who performed the study as the second acupuncturist performed the acupuncture treatment alone, and he started acupuncture with this study. So I've shown him this, and he was not very happy to do this alone, but when I wasn't there, so he had to perform the acupuncture by himself. So, and you see here this values, they are particularly the difference between Verum and sham acupuncture with a standard error of difference. And well, so my colleague told me that I can publish his results. It's no problem, because now he is an expert. Now he's doing acupuncture 3 years, and so you've seen that he received this difference between acupuncture and placebo, 0.7, almost 0.8 on this numeric rating scale of 10, and this is, as we know from evidence-based research, is clinically irrelevant. So everything clinical relevance starts from 1, and it was also in our study statistically insignificant. When we did acupuncture together, so he distracted or I distracted, and then we have reached the optimal result, almost 1.6 difference. So this clinically relevant, and was also statistically significant. So this is a very interesting result for especially for acupuncturists. Then you can say here is the evidence that also to learn acupuncture, it is worth to learn acupuncture. Well, now I come to conclusions. So my short report, you've seen that acupuncture improves clinically relevant pain and accelerates the ambulation of patients after Caesarian section in comparison to placebo with no side effects. With additional consideration of personnel and time expenditures, acupuncture can be recommended for postoperative pain control in patients scheduled for Caesarian section in spinal anesthesia. And in the meantime, we're discussing the opportunities to refinance our acupuncture therapy, because as you know, we are doing, for example, P6, pericardial 6 stimulation for prevention and treatment of perioperative nausea and vomiting as a standard in our clinic since 2008. And the second step is the acupuncture for pain control after CS. So now we're discussing with the health insurance companies how we can refinance this. And anyway, so our chief of our department and the administration of our hospital, they decided to support us to perform acupuncture in women after CS. Anyway, if it will be refinanced or not. So we will cover all this personnel and time losses from from our departmental resources. Well, and what we're going to do the next, just prospective assessment of cause and acceptance of acupuncture and treatment of postoperative pain in patients after Caesarian section, because you've seen that a quarter of patients, they refuse to have acupuncture, so we have to look why is that, and so on. Well, just an old picture to see that this from Europe, but from Middle Ages. So, so we did some steps already and achieved the progress in the care of birth-giving women, and going to do it also in the future. So this is not our hospital. Our hospital is this one in Greifswald. This is an old building where plenty of famous surgeons worked, and one of them, August Bier, who officially invented spinal anesthesia, worked there. And this is our new building where we performed also the study, and the skyline of Greifswald from one artist who also spent a couple of weeks at our intensive care unit. Well, and of course I was not alone. Was doing this study. This is our research group. Well, and thank you very much for your attention. If you have any questions, I'm happy to answer them, and then can show you some stuff for we use for this study. From feeling, it should be here. So, this is our results. Here. So we have to have here some standard therapy group. Standard therapy group was around 6.2, 6.3, and here the placebo was at 6. So now, without third group, it's difficult to say if there was a placebo effect or not.